the topic of discussion that we are going to cover right now is we are going to cover about CSF, right? We are going to talk about cerebral blood flow and blood-brain barrier. Now, it's a easy topic of CNS. So, without delay, let's move toward the topic. Okay, now talking about what fluids in central nervous system. Okay, fluids in central nervous system, they are mainly for what? One is for lubrication and another is for nutrition. Now for lubrication and for protection, we have got what? Cerebrospinal fluid. We have got cerebrospinal fluid. And for nutrition, we have got cerebral blood flow, right? For nutrition, that means for oxygen supply or for nutrition, we have got cerebral blood flow. And what we are going to talk about, we are going to talk about this cerebrospinal fluid and cerebral blood flow also. Okay, now let's begin our discussion with CSF, cerebrospinal fluid. Okay, the normal volume of CSF is about 150 ml, right? Somewhere it is written about what? 100 ml to what? Plus minus 10 ml. So this is about the normal volume of CSF. Now the rate of CSF production, right? The rate by which CSF is produced, it is about 550 ml per day. 550 ml per day, and recycling is mainly how many times? 3.7 times a day. It takes place 3.7 times a day. Normal CSF pressure, what is the normal CSF pressure? It is 70 to 180 mm of H2O. Remember the unit, 70 to 180 mm of H2O, right? Okay, now where it is produced? It is produced, the site of production, it is produced in choroid plexus, and detail of choroid plexus and these and that things we will be studying in anatomy. So now since there is the site of production, obviously it should be absorbed from somewhere also, and it is absorption, it is absorbed from what? Araconid villi, araconid villi. Okay, and this site of absorption or araconid villi, it is also what? It is also the site of regulation. That means a regulation occurred at the site of absorption or at the site of araconid villi. Okay, now okay, we talked about what? We talked about general property of CSF. Now let's talk about what? Circulation of CSF. Okay, talking about circulation of CSF, what we have is, okay, now initially what I mentioned that the site of production is choroid plexus, right? Choroid plexus. These choroid plexus are present in different region of brain, okay, different ventricle of brain. Okay, let's see in this diagram. Okay, now CSF is secreted by choroid plexus in each lateral ventricles. Okay, here you can see this is our what? Lateral ventricles, right? What is this? This is our lateral ventricles. Now from here CSF is produced. Okay, now what will happen from this two? What is this two structure? It is interventricular foramen, right, or foramen of Monro. Now this CSF which is produced in each lateral ventricle, they will be what? They will be sent through this structure. This is what? Foramen of Monro into what? Into our third ventricle. Now third ventricle. Now in third ventricle, what will happen? Choroid plexus of third ventricle will add more CSF, right? Choroid plexus in third ventricle will add more CSF, and also it is carrying the CSF from our lateral ventricle. Now here in this third, from this third ventricle, now from this third ventricle, CSF will flow down through what? Cerebral aqueduct or the aqueduct of Sylvius. It will flow down what? Through aqueduct of Sylvius. Now by flowing down through aqueduct of Sylvius, as you can see, what is this? This is cerebral aqueduct. Now it will reach where? It will reach into fourth ventricle. Now choroid plexus in fourth ventricle add more CSF. In fourth ventricle, right here, it will add what? It will add more CSF. Now after adding more CSF, now what will happen is that CSF flow out two lateral apparatus and one medial apparatus. Now what will happen here? The CSF which was contained in what? Fourth ventricle, it will what? It will go into medial apparatus, right? Medial apparatus and what? And two lateral apparatus. What? Two lateral apparatus. Okay, you can see lateral apparatus right here, right? And you can see medial apparatus right here. There are two lateral apparatus and one medial apparatus. It will go into these places. It will go into these places. Okay, now after this, what will happen is that CSF fills subarachnoid space. Now what is subarachnoid space? You can see these are the subarachnoid space, right? Subarachnoid space of spinal cord and brain. It will fill subarachnoid space. Now after filling subarachnoid space, what will happen? It 8 aragonite granulation, right? There is aragonite granulation from where there are aragonite villi, and CSF will be reabsorbed into venous blood flow of dural venous sinus. We have already said that aragonite villi is the site of absorption of what? This CSF. Now after absorbing, they will again get back into venous system of what? Dural venous sinus. So let's revise again. From lateral ventricle, what? CSF was produced, both. Now from that foramen of Monro, it will go into third ventricle. In third ventricle also there will be production, and it will go through with the help of aqueduct of Salvius into fourth ventricle. Now this fourth ventricle will send it to subarachnoid spaces with the help of Magendai foramen and foramen of Lasca. And this subarachnoid space, now what will happen? There are aragonite granulation that will what? Help in absorption of this CSF, and they will be sent back to venous system of dural venous sinus, and they will reach to superior sagittal sinus. That's all. This was absorbed. Okay, now moving further, let's compare what? Our CSF with plasma. Now while comparing CSF with our plasma, CSF has higher concentration of chloride. It is so important. The chloride concentration is about 120 to 130 milli equivalent per liter, right? And magnesium is also comparatively higher in our CSF, and partial pressure of CO2 is also comparatively higher in the case of our CSF. Okay, moving further, talking about equal concentration, how our plasma and CSF are having are equal, or they are equal in the term of osmolality, and in the term of bicarbonate ion, they are what? They are having equal, or they are equal. Now our CSF, they are having low concentration of glucose, protein, potassium and calcium, right? About 2/3 of plasma glucose is only present in our what? CSF. So this was important point, right? What we talked about what our CSF is having higher concentration of chloride, magnesium and PCO2, and equal concentration of osmolality, bicarbonate ion, and low concentration of glucose, protein, potassium and calcium. It is important to know. And one important thing that we need to know is only protein that is present in our brain is our in our CSF is our what? Beta 2 transferrin. It is only present in our CSF. So it is used for diagnosis of what? CSF rhinorrhea. So it is what? It is the marker, right? It is the marker. So for our CSF rhinorrhea, CSF otorrhea. Okay, now what? Talking about cerebral blood flow. Now cerebral blood flow, or the blood flow in what? Our brain, is mainly done by circle of Willis, right? In detail we will be studying in what? We will be studying it anatomy. The normal cerebral blood flow is about 750 ml per minute, right? It is half the blood that is sent to liver. The maximum blood flow occurs where? In the case of liver, that is 1500 milliliter per minute. And the area that will get the maximum blood supply is our areas of gray matter, right? They receive blood more than that of area of white matter. The brain oxygen consumption is about 46 milliliter per minute, and it is about what? 20% of total body oxygen consumption. That means out of 100% of oxygen that is consumed by body, 20% is consumed in what? In brain. Okay, so the brain is highly sensitive to hypoxia, right? And the most sensitive side is hippocampus. If you remember, the hippocampus is concerned with learning and memory, and hippocampus was the site of what? It was the site of production of our which wave? Hippocampus. It was the site of production of what? Theta wave, right? Theta wave. And theta wave was responsible for what? Responsible for converting our what? Our short-term memory into long-term memory. So this was about what? Cerebral blood flow. Now the regulation of cerebral blood flow, how it is done? The regulation of cerebral blood flow, it is done through various it occurs through various processes such as blood pressure, right? When there is fluctuation about 65 to 140 mm Hg of pressure within cerebrum, right? What will happen? There will be no effect in what? Blood flow, right? No blood flow change will take place. It will remain constant. That means because of some reason, if there will be about 65 to 140 of change in blood pressure, then it will not affect any of what? Cerebral blood flow. Why? Because it is auto-regulated. It is auto-regulated. And talking about PCO2, right? If partial pressure of carbon dioxide is increased, then blood flow will also increase. And talking about temperature, it is so important. Temperature is very important because when body temperature decrease by 1 degree Celsius, when body temperature decrease by 1 degree Celsius, cerebral blood flow decrease by 7%. That means hypothermia, right? Hypothermia is induced during neurosurgical procedure. That means while doing surgery, we can do what? We can decrease temperature. Why we can decrease temperature? Why we need to decrease temperature? Because this will help in what? Minimizing the blood loss. What will happen? It will decrease. By decreasing temperature, what will happen? There will be decrease in what? There will be decrease in cerebral blood flow. So while doing neurosurgery, what surgeon will, what he will do? He will lower the temperature, right? He will lower temperature. As the temperature will be lowered, the cerebral blood flow will be also lower. So this is important. Okay, now there is one term that we need to know. You might be wondering what it is. Monro-Kelly doctrine. Now what is this Monro-Kelly doctrine? The Monro-Kelly doctrine, right? Okay, it says that the volume, right? Volume of what? Volume of our what? CSF, our blood, right? Blood, cerebral blood, and brain tissue. These are always constant, right? The volume, right? The volume of CSF, blood, brain tissue is always constant. Okay. By any chance, if there is what? There is increase in one of the parameters, such as if CSF will be increased, then what will happen? This blood and this brain tissue, what? They will compress to maintain what? To maintain the constant volume. So it is written same thing, right? At any point of time, the volume of CSF, blood, brain tissue should be always be constant. It should be always constant. If there is chance in any one of parameter, right? If there is change in any one of the parameter, the other two will be compressed. Such as if CSF will be increased, it will compress the brain tissue and blood flow. So it is what? It is Monro-Kelly doctrine. So it is Monro-Kelly doctrine. Now moving to our another topic, and that is blood-brain barrier. Now what is this blood-brain barrier? Okay, what? There is what? There is blood vessel, right? There is blood vessel. Now this blood vessel, the endothelium of this blood vessel, it is formed. Okay, what is here in this blood vessel? Here it is tight junction. What is here? Here is tight junction, right? And also there is what? There is astrocytes, the food process of astrocyte. Now these, the tight junction and food process of astrocyte, this forms what? This forms blood-brain barrier. It will not allow what? It will not allow everything to get into our what? Brain. It will block. Look, it will block. It will not allow to enter. Okay, now what are the substances that can cross blood-brain barrier? These are what? These are glucose that will be transmitted through what? GLUT1 transporter, right? Glucose transporter type 1. Similarly, water can be also transported through aquaporin 4. And the lipid soluble substance such as steroids can also what? They can also pass. Similarly, gases like water, carbon dioxide, nitrogen, they will also pass. What are the substances that cannot cross blood-brain barrier? These substances are what? These substances are water soluble such as protein, hormone, right? Water soluble cannot cross blood-brain barrier, but water can cross because there is aquaporin 4 that will help in crossing of this water. So the water soluble substance such as protein, hormones, dopamine, right, will not cross blood-brain barrier. So for treatment of Parkinsonism, what we do is we provide L-dopa, because the dopamine will not what? It will not cross blood-brain barrier. So we will what? We will just what? We will treat it with L-dopa. And H plus ion, they will also what? They will also cross the blood-brain barrier. Okay, we need to know about some of the area in brain where there is what? Absence of blood-brain barrier. Now what are these area? These area are what? These are circumventricular area organs, right? Now these areas are found in circumventricular organs such as SOAP. This can be memorized with SOAP. Now from S we have got what? Subfornical organs. From O we have got organum vasculosum of lamina terminalis. from A we have got area postrema, and from P we have got posterior pituitary. So these are the organ where we will not find blood-brain barrier. So for a quick review, I would like to ask you some of the questions. Okay, which of the constituent are more in CSF than in plasma? The options are bicarbonate, right, chloride, glucose, and another magnesium. Okay, which of the substance, okay, which of the constituent is more in CSF than in plasma? Here if you look carefully, then bicarbonate is more in what? CSF than in plasma. Chloride ion is more in CSF than in plasma. Glucose is magnesium is more in CSF than in plasma, but glucose is less in what? It is less in CSF. Glucose plus protein, they are less in CSF. So the question should be, the following constituent are more in CSF than in plasma except, and the answer would be glucose. So I asked you wrong question, no worries. Now another question, the blood brain barrier is absent in option number A, area postrema, right, area postrema, okay, area postrema, anterior pituitary, another option choroid plexus, cerebellum. Where is our blood brain barrier absent? In area postrema, that's all. So this was what this was about our CSF, cerebral blood flow and blood brain barrier. So have a great time. Thank you.